this concept of we really need to be healthy. We need to make an investment in our health.
Sure.
We invest in cars and we invest in boats and houses, but how many people are really making the investment in their health?
Sure.
Unfortunately, this year has kind of brought forth this idea that maybe our health is important.
Yeah.
I can tell you coronavirus is ravaging this country, and the people that are not healthy do poorly.
Sure.
But, so again, my message is I'm all about how do we deliver to you the information for you to be healthy. And I use real medicine. I'm big into supplementation. I became very fascinated in the world of CBD when I took my first coursework about 4 years ago. I went to a national conference and they sort of kicked off this idea of talking about CBD and it was on like the last day, and I walked in and it was standing room only. There were 400 physicians listening for this. So we knew that CBD, cannabis, THC, however you want to call it, had an incredible upside. And now it was just, how do we get the science to you? How do we get the information to people that this is real therapy for a whole lot of people?
Sure.
This is not, this is not, I'm sitting under the bridge smoking a doobie, I mean, God knows we all did that in high school, but
Right.
This is more than that, because
Or yesterday.
we're going to find that cannabidiol and CBD and cannabis and the extracts are going to be huge medicinal players in the future once we get through some of the legislative and regulatory issues.
Sure, and that's something you and I have had a conversation back in the past. Is ultimately now we have access to these studies and things that we always knew something about, but even I guess most recently we're finding out, and you and I briefly talked about it before we got started. We're finding out that not just the cannabinoids of the plant are effective in our body, but we're also finding out that terpenes within the cannabis plant are playing a major role as well. So let's go full circle. You said you're on the front lines of COVID and the front lines of all this. Ultimately, I got questions about this. You're seeing studies now that's showing that CBD or cannabis could ultimately help reduce inflammation and some of these harsher effects of COVID. Is there truth to that? Or is there more studies?
So, yeah, that's a great question, and it's very, very timely. So we have to understand that, first of all, the human body has something called a ECS, or a cannabinoid system. We have built-in receptors in our body. So we have to first understand that there is a place for this, okay?
Sure.
Now, I don't want to get too far into the science, but we know that there's CB1 and CB2 receptors, and they're actually finding more and more. But to get to the point of coronavirus is a disease of immunity.
Okay.
Because what happens is the virus enters your body and then creates this gigantic immune reaction. And how well your body deals with this immune reaction is really how devastating this disease will be for you.
Wow.
Okay? So anything we can do to upregulate or make your immune system stronger, or help you once it hits to make sure your body does not get overwhelmed, allows you to make it through this disease more like the common flu and less like the disaster we see every day.
Wow.
Okay?
And I guess it's terrifying for everyone, but I guess being in the front lines, you're probably more jaded to it. But I guess what's most terrifying to myself and the people I've spoke to about it is the uncertainty of, am I going to be asymptomatic like some of these folks, or am I going to be on a ventilator and passing within a few days? And has there been any rhyme or reason besides underlying health issues of like, are there different strains of this? Are there different strengths? Is it a matter of the exposure you're getting?
All of the above, and realize there are 15 strains of this current coronavirus.
I know. Wow.
And now they've found this new one that came out of UK and has now been seen in Colorado, which is it's not more deadly, but it spreads quicker. It spreads more.
Easier, I think.
So let me kind of talk to the listeners about this. The problem we have as medical practitioners and doctors and nurses is that we can pretty much give you an idea. If you have certain health conditions, you are more likely to do poorly and have a problem with this disease. And I'll be happy to go over those. The difficulty is I am seeing very healthy people have bad disease. And then what we really don't know yet is this idea of what we call long COVID. So long COVID means your body gets ravaged by the disease, and then your body is really in this survival mode for so long, and it could take years to get over this thing because of the damage of all this immune reaction.
And that's what I guess too. Personally knowing people now that's had the COVID disease, a few of them were asymptomatic, but they remain testing through this. And what's so crazy is they would show a positive test for the virus being present, but through the entire process show negative for the antibody test. And, again, being asymptomatic, and some of the people I know had shown like reactions, like I hear of like organ swelling and things like that. It's like subsidiary reactions, the things what you would think a cold or a sickness would be immediate, lungs, sinuses, something like that. But it sounds like this affects all sorts of different parts of the body, depending on the person.
This can really do some damage. We're seeing more strokes in younger people. We're seeing cardiovascular heart disease. We're seeing kidney disease. I mean, this folks, I don't want to be a Debbie Downer on this thing, but please take this thing seriously for a while till we can get ahead of it. It's dangerous and unpredictable.
And it seems like it's hitting closer and closer to home. Honestly, from the numbers, it seems like the hospitals are becoming somewhat overwhelmed again.
We are completely overwhelmed right now.
Wow,
That's true. I will tell you from the front lines. When I was in the ER last night, there were 21 people waiting at all time.
That's crazy.
We couldn't begin to manage what we had.
I got so many questions. I don't even know where to start or whatever. So
well, let me get back because you kind of brought it up.
Sure.
So there's been some theoretical, and I always have to say theoretical because we really can't get a lot of this proven yet, but we know because this CB2 receptor is involved in our immunity and the immune cells of our body. If we affect it in a positive way, we can help with immunity. So I don't want to get lost in all the science, but we know that it can really affect positively this thing called the ACE receptor, which is where the virus enters the body. And then there's another thing that you'll hear, it's called apelin, APELIN, which again, we're starting to see as sort of a doorway for this thing to get into your body and ravage it. And CBD can downregulate that. Wow. So I can't sit here as a scientist and doctor and say, well, CBD is going to solve the COVID problem. No. But if your immune function is doing well, and we have things to stop you from really maybe having this overwhelming effect, use them.
Yeah. I guess and like you said, any way you can boost your immune system is overall a good idea anyway, especially this time during a normal flu season.
Absolutely.
So, I guess down these same lines, CBD and things helps inflammation, helps with, having a better outcome of this. We're hearing more and more too now of people that seemingly have no underlying health conditions and do poorly and shut down. Is that just maybe still an unforeseen health condition, or is it just still like that?
Again, it came to light for me when one of my own patients who was super healthy really got very, very ill. And I know another doctor that I've worked with that was on a ventilator and they thought he was going to die and was healthy and didn't have other reasons for this to occur. So That's why, again, I can sit here and tell you the health conditions, if you have them, are going to put you at more risk. But the best thing I can tell you is do your best to avoid this thing.
Yeah, absolutely. So again, let's get into that. So what they're saying, face mask, hand washing, social distancing, ultimately effective? Or, I mean, we see doctors on the news at night, and you guys are wearing spacesuits. And ultimately, we're hearing you guys are still becoming effective.
Well, again, we're in a suit, though. I mean, you know, it would be unfair to categorize us because we're seeing so much of it. It's such high volume and a large amount of disease that, that's why they vaccinated us. And I will tell you, I have been vaccinated once, and we'll have the second vaccine next week. And
let's talk about that real quick.
Yeah.
Which one? There's two now, right? Pfizer and Moderna.
Pfizer and Moderna, and then AstraZeneca's will come out soon.
Okay.
But that's mostly in the
So
UK.
how do you, number one, which one do you go with? You want to?
So I wasn't given a
preference?
choice.
Okay.
The hospital system I work at, we got Pfizer. I know colleagues that also got Moderna.
Okay.
So quickly on the vaccine, there are people that will get on and discuss the rhetoric regarding the vaccine. The difference for most people is one is taken 3 weeks apart and one is taken 4 weeks to 5 weeks apart. And that's the big difference. And the other issue is one has to be stored at a much colder temperature than the other.
Shelf life.
Beyond that, there is really no difference.
So it has to be constantly stored at a certain temperature, so a
Correct.
pretty sensitive shelf life.
Correct.
I imagine probably very short shelf life as well, or no?
Again, we will see that some of them can last months, but again, these vaccines will get used up fairly quickly.
So have you taken, both of them are two-part vaccines?
Two-part.
So have you taken both parts so
No,
far?
again,
Okay.
I've had the first, and
okay.
I get the second next week.
So that's cool. So, and I'm hearing once you get this vaccine, it's still recommended to social distance, wear a mask and all that, and it takes some time, I guess, for the vaccine to take effect as well.
Right.
Where
So
it's effective.
let me cover that and try to.
Sure.
Let's be blunt on this thing.
Sure.
Folks, understand this vaccine does not prevent you from getting coronavirus.
Right.
Okay?
Okay.
This was a brilliant piece of science that is stopping you from getting the overwhelming reaction by affecting something on the coronavirus called the spike protein.
Okay.
When you look at the coronavirus and you see the little things, those are spikes. That's what causes everything.
Okay.
So this vaccine sort of insulates your body against you having this overwhelming reaction. So you could still get you can get a corona vaccine and still get coronavirus, but you're less likely to have the overwhelming immune response and reaction that could put you on a ventilator and lead to your demise.
Wow. Okay. So then, wow, it's so crazy.
Let me also finish on that.
Yeah, go for it. Yeah.
Because there is lots of rhetoric being out there about microchips and barcodes
Right.
and this and that. And folks,
other than the ones we carry around and talk on every day.
These companies, you can go on. I can get you all this information. The only thing in this vaccine are some preservatives like potassium citrate. There's some fats, some lipids to help it carry it, and there's the vaccine or the mRNA itself. They are, to our knowledge, and they even interviewed all the people that would potentially make these chips.
Right.
None of these, that is not true data, so don't let that keep you from getting a vaccine. And
Sure.
I'm going to go ahead and be blunt again, and please get the vaccine.
Yeah.
We need to eradicate this
This
disease.
is something my wife and I, we talk about often between us. We have two small children, and we often have gone back and forth on vaccine and things. And ultimately, our personal beliefs feel like we're probably over-vaccinated, but at the same time, we don't deal with a lot of things we used to. So obviously, it worked in some fashion. Of polio is no longer really an issue, or smallpox, or things like that. So even with it having the 19, does that mean there's 19 variants before this one, or is it 19 just the number 19? Does that specify it to a
19 is based on the year it came out. So that's where you get
wondered how that
coronavirus 19. So that's where it is. All right.
Wow.
Coronavirus as a virus has been around for a very long time. This was especially, let's get this politically right.
Sure.
This was a specific virus that had great infectivity and created a huge immune reaction. Okay. But we've dealt with coronavirus for 50 years. So coronavirus is not anything new.
Right. And I've often wondered that, because I know just enough, I guess, to get myself in trouble. But what I've noticed is there's just so much misinformation. And literally at the beginning of this thing, we had part of the government saying wear masks, the other part saying not. Our own Surgeon General saying they're ineffective. Dr. Fauci saying wear them. So, what would you say is the most credible source right now for this information besides yourself? How would people like Basel and myself, where would we go besides talking to our own doctor? Where would we go to get this information?
Information could be on the CDC.
Okay.
And they're pretty reliable. And I got to tell you, the CDC fumbled the ball in the beginning.
Sure.
But they're credible. I'm not a big fan of Fauci, but he's pretty credible.
Okay.
The rest of the government, I don't trust. I'm sorry.
Sure. I don't trust government very much
because they have an agenda.
Yeah.
So,
and I think that's where the fear comes in, because my wife and I, again, we talked about it for ourselves. We get the vaccines for our children. For the last few years, I've got the flu shot where I was against it for so long. But her and I discussed it, and I think for ourselves, with being an overweight person that was a lifelong smoker, I'm probably not going to do well if I came down with this virus, I would guess. So we take a lot of precautions anyway, but I think personally we've decided to take that leap. So do you have, like, going into this, you had no choice?
I have choice.
Well,
I have choice.
You have choice. Well, we all.
Let me, and we'll finish on the vaccine, because people are tired of hearing about all this stuff. So I chose to get the vaccine because as physicians, we felt we had to be in a position of leadership.
Okay.
We needed to take it and show the rest of the world, okay, we took this thing. And I now see more people that are following us.
Sure.
But if we didn't lead, I find, God knows, I'm really disappointed in our leadership of the world right now.
Sure.
So somebody needs to pony up a little bit.
Step up.
And we did.
Right.
As far as people getting the vaccine, and again, you probably won't be offered it until the end of Q1, maybe Q2 of next year. These are the people I will tell you to be careful with.
Okay.
People that have had known allergic reactions to certain things, especially big allergic reactions. People that have autoimmune disease, and we really don't know the answer on pregnant people. We think it's safe under 16, but it's never been tested thoroughly under people on 16 years of age. The first vaccine, I had a sore arm. The second one is the one where you're more likely to feel something and get a fever and have some body aches and flu-like symptoms. I will be happy to tell you on the next what happened after the second one, but that's next week.
That's cool. So is this something that's effective treatment once you've contracted the virus?
Absolutely.
Okay.
Again, I can tell you anecdotally, one of my nurses got the vaccine. She had coronavirus in the last 45 days. She had a rough first day from the vaccine, but we still think for those of us on the front lines, those of us at risk, the vaccine is the best way out.
That's the vaccine, okay. So I mean, again, so if you didn't choose Pfizer, or Pfizer wasn't chosen for you, would you recommend people maybe go through some kind of checklist to figure out which one would be best for them?
Again, it's what's going to be offered.
Yeah, both, okay.
I think they're so equivalent. It really.
So I guess without getting too far in it, what do you take? Ultimately, take people's blood or something that's contracted this virus, breaking it down. How you come up with a vaccine? You find certain, I guess, particles.
That's how we used to do it.
Okay.
This was
how does this work
the
now?
most incredible win the Nobel Prize of how they did it, because they basically figured out where the problem was, figured out the genetic piece of it, and then spliced all these genes. I mean, they basically made a genetic code.
Wow.
It's just incredible science.
That's really incredible. I've always wondered like this.
And this is going to be one of the new waves of the future to eradicate other diseases beyond coronavirus.
And that's what I was wondering.
It's pretty fascinating stuff.
And it's almost like I said, I always wondered if we had kind of a world conglomerate of resources putting through this, because it seems like everybody's kind of been outposted working on separate things, and it seems like the whole science and medical community came together in an emergency session to make this happen. Am I correct in that assumption?
You're absolutely correct, and you also need to understand that the research on what we're doing, which is these RNA viruses, has actually been going on for years now, but the funding stopped, and this stuff is expensive to try to.
I can imagine.
But this is brilliant science. This is Star Wars.
So,
I mean,
Absolutely. So. Man, what a bunch of
Corona.
Yeah, enough Corona. I'm reading some of these comments, and hey, everyone, thanks for joining us. But if you guys have any questions for the doctor, feel free to join in and type them as well. We're gonna keep spitting knowledge. He's going to keep sharing all kind of fact-based knowledge for us. But as we're doing so, if you got any questions, feel free to write in. And again, thank you guys for joining us. So ultimately, there's not a lot of you out there, Dr. Farris, that even look towards the cannabis world. Is that another fair assumption, I would say?
It is a fair assumption. And again, this is back to lack of knowledge leads to ignorance.
Sure.
And so I just became very fascinated in it. And then when you start doing the research on it, you start to look at it in a different light.
Right. And that's always been my argument. Look, give us the ability to test these products. Give us the research and development, the science behind it. And if we find out it's somewhat harmful for us, which we all know it's not, I'll be the first one in line to say, hey, we were wrong. And now we're finally getting these opportunities to figure out the testing and stuff. So on a medical level or on a national level, is there any specific studies that are now underway or planned for the cannabis studies?
Well, we're getting more and more, and there's being more money allocated. I can tell you in 2019, there were 644 published studies on cannabis. I mean, That's an incredible number of studies. So for someone to sit there and say, well, there's no research on this, it's malarkey. Right. Or we can use another word.
Right.
But
whatever you want. Yeah.
The difficulty where we run into as scientists is the world wants a certain type of research done, and because of how we're doing this, the research numbers are smaller. It's harder to recruit people. There's less monies involved in research, and so we're seeing a lot of what we call lab research on rodents and whatnot, and then we try to bring, well, if it worked there, it could work here. We're starting to see preliminary studies, and then it's up to clinicians like myself who use it to say, okay, I've used it on people with Parkinson's disease. I've used it on people with ALS. I've used it on people with, Alzheimer's, and this is what I saw, right? I mean.
So are you able to prescribe yet or just still recommend?
Well, again, I recommend. I'm waiting for the state to
get on board.
Right, and then I will, when they allow us to do the prescription medical, I will certainly get in line and get that license.
That's awesome. Because, yeah, I mean, from my experience, and it's getting better, ultimately you go to a physician, your own physician or other physicians, and immediately, literally, I went to a doctor's office one day, ran into someone. They said they'd be interested in me speaking with their doctor that they work with about CBD. And as I came through with my CBD samples through the door in my CBD shirt, they asked me why I was there. And the minute I said CBD, it was like I cussed the place out or I was some kind of harm to them, because they immediately pushed me out the door, literally, and said that they weren't interested one bit. So I'm seeing the tables turn. I think Dr. Farris is definitely ahead of his time as far as the physician world. From what I've seen, there's not a lot of people that champion it, but I think the doctors that ultimately are looking for ulterior medicines are more, homeopathic medicine or more earth-based medicine are more open to this than those that are strictly pharmaceutical. And from my personal experience, it seems like you kind of play a little in both fields, where you have experience in both, and Dr. Farris, if you go see him in his personal practice, it's kind of an approach of medicine and homeopathic, right? Am I correct in that?
It's not true homeopathic.
Right.
But we use alternate and complementary things. Let me go ahead and steal his thunder and get going where I want to go. So COVID has also brought about significant issues with mental health.
Yeah.
Okay?
Let's talk about that.
So, let's talk about mental health, because I see so many more people that are wanting to harm themselves and are depressed and anxious, and I will tell you, and this is where it's very interesting. The easiest thing for a clinician to do is write you an antidepressant.
Right.
70% of people that take antidepressants get no effect from them. Okay?
Large number, yeah.
So I had to get my head out of the sand and go, you know what? Is there an alternative therapy? CBD is an alternative therapy for mental health related issues. It has now been proven.
And how so, doctor? How does it help us? I know the effects of it, and I see it myself, but I guess scientifically, in layman's terms. How so?
Okay, again, we start to use these plant-based products that create this thing called an entourage effect, which if you haven't heard that, look it up, it's very important. And CBD does not get in and what's called bind the receptor completely, but it affects the receptor in a positive way. So now it starts to turn on certain receptors or things in your brain that make certain chemicals that are positive for you.
Okay.
You'll hear these things, the dopamine and the serotonergic and GABA and glutamate. And I mean,
I've heard all those terms. Yeah,
you know, and we're seeing that CBD modulates, because that's what it is. It's a modulator.
Sure.
It's like, I tell people, it's when, you know, and I'm old school, and we used to have the bass and treble knobs.
Right.
Really?
Sure.
So what CBD is adjusting your bass and treble knobs. Okay?
Right.
It's not necessarily amplifying the volume,
Right.
which is what some things do. It's starting to modulate in a positive way these neurotransmitters, and then we start to see this sense of calm and this sense of downregulation of this state that gets people in trouble.
Well, I guess the most common question leading into that I get most often is, how much do I need? What is effective for me?
Boy, that's a great question.
Right.
That is a, you know, and that's the question that I find that people that are not in the know struggle with.
Right.
And there's I'm going to get on this quick soapbox. There are too many people that are selling this product who don't have a clue about how to dose it. Okay?
Right.
I went to his store one day, didn't tell anybody who I was, and their people knew what was going on.
That's good to hear. We
You
appreciate
know?
it. Yeah,
And-
for sure. We love to hear when we get it right.
So always when we start to talk about this, we're going to start at the lowest dose and work our way upwards. Okay? Because we can always modulate doses upwards. We start to have side effects when dosages are high. Women always get started on about a 12.5 milligram dose. Men usually can tolerate 25 milligrams. For mental health issues, especially anxiety, I like to do twice a day dosing.
Yes, sir.
Okay? Depression, same way. I find that we get better results with twice a day dosing.
It helps spread it out over your day.
Correct.
Ultimately.
But that doesn't mean that's your final dose. We have to kind of find our way on what is the specific dose, because I can assure you he and I will need different doses.
Yeah, for
And
sure.
Bracell and I will need different doses.
Yeah, for sure.
Not just based on size,
I'll
but
just
about
tell you
on
right now,
metabolism.
my dosing is ridiculous for those that are wondering. But and it does have some side effects, for sure. Being overweight is one of them. But you talked about that earlier. There's actually things now that can be added, or they're part of cannabis, that ultimately can subside what we know as the munchies, or the hunger that is amplified sometimes from cannabis use and full spectrum CBD use, not just what we know as marijuana, correct? So there's now some appetite suppressants we've found within this plant, or?
Again, we have to also understand there's lots of these receptors in your immune system, and the majority of your immune system lives in your gut. So it's talking.
Sure.
This is talking to this is talking to this, whether you consciously know it or not. So when we get this endocannabinoid tone up, which is what a lot of people are deficient in and don't know it, then we start to have the proper crosstalk, so that we sort of can get rid of some of this idea of hunger pains and cravings and things like that.
Sure.
And that's where we start to make our impact, because if you're not craving things, just don't have it in front of you, you do fine.
Right. Yeah. Which is a struggle I definitely struggle with all the time. And it's, cannabis can definitely give you much of an appetite, but it's more about your input once you do have that stronger appetite. So one of the questions someone asked, Greg, what's up, Greg? Does CBD or marijuana combat getting corona?
The answer to that is nobody knows, and it's probably that it does not prevent you or from getting corona. But again, what it can help to do is make your immune system a little bit better,
Okay.
so that if you do get corona, you will have hopefully a milder case.
Okay. And then this also related as well. I had a question come in earlier before the show. Someone reached out and wanted to know, does CBD or cannabis affect in a positive way or negative way fertility? Is there
Oh
anything we
boy,
know?
that's been looked at quite a bit. Again, most of the studies have been done on THC.
Okay. Trying to prove its negative effects.
Right. So they have found it. It can decrease some sperm count. It can decrease a little bit of fertility, and that's more been seen with THC. It's not really been studied enough in CBD, to my knowledge.
Sure. So when people are talking about CBD, as we know, we can get CBD by itself, isolated by itself, but we also can have it in broad or full spectrum. Let's talk a little bit about the differences of what's probably more effective for our body, because not everyone can take the full spectrum. It contains THC. THC is the part that shows up on a drug screening. So a lot of people, for employment reasons or criminal reasons or probation or whatever, cannot have THC in their system. So ultimately, without that caveat of a failed drug test, what would you recommend as a physician? Broad spectrum, full spectrum, isolate? What would you recommend as far as that goes? And
that's
that
another
THC
that's
piece.
another great question. So, interestingly, that many of the studies were done on isolate, and I'm not a fan of isolate. Okay, so
Myself excluded. Yeah.
that's just me. I'm not saying isolate is the worst thing, but given the options, isolate would not be my go-to.
Okay.
Okay.
So and you spoke about the entourage effect. So I imagine our bodies react better to ultimately the full plant.
Correct, because when we get the full plant, now we start to incorporate many of the, and again, when you start looking at the cannabinoid spectrum and the THCA and the CBG and all the other pieces of the cannabis plant, we want this all working in together to create what's the entourage effects. Then we start adding in the natural plant oils known as terpenes.
Right.
And that's where the frontier of research is very fascinating for people like me.
Right, and I'll tell you, from being in this industry a long time, longer than the short few years that we've now been in the legal realm, traveling out west to fully legal states where full access for adult use is available. Of course, in the beginning, everyone wants that high THC level. They want to get high, and there's nothing wrong with that. I enjoy getting high myself. It's not for everyone, but when you go back to these places that's been in legalization for over a decade now, Cali and some other places, California, Colorado, you notice it's gone full circle. And people that have the full access to it don't necessarily want to get high all the time now. It's gone full circle where they're looking, what other benefits can I get from this? And I've got to function during the day. One guy out there as a grower said the only thing that he can achieve after smoking high THC levels or consuming high THC levels is cartoons and snacks. He said that's the only thing he can achieve once he do it. And so it's not for everyone. So I guess what I've seen happen in the industry, and it'll lead into where you're coming from, is now we've realized, hey, this thing does a whole lot more than get us high. It can regulate mood. It can regulate appetite. It can regulate libido. Literally all parts of your body, and this is the endocannabinoid system is the largest system within our body, correct?
That's probably true.
So the deal is we're now finding that as we feed our body these cannabinoids, we get all different effects besides high. So my point is, in these states that have had full access for these many years are now breeding the plants to produce not just high THC levels, but other high cannabinoids, and also high in terpenes. And terpenes is what gives cannabis the flavonoids and terpenes gives it that smell and that taste. A lot of them are familiar scents because they're found in many things we already consume, correct?
Right. I mean, terpenes, if you like lavender, the smell of lavender is a terpene. The smell of lemon is limonene. Okay. Right. The smell of a pine tree is pinene. These are saps of the plant. This is what a terpene is.
Sure.
Okay. This is a natural plant product that now has an additive effect to, and that's why you'll hear me go, I am a full spectrum. If you are allowed to take it, full spectrum is my go-to.
Sure. So for those that don't know, Dr. Farris has a whole lot of accomplishments, but he is also a triathlete. And some of your own experience with CBD and things is help you recover faster and from an injury. Correct? You'll tell a little bit about that.
Yeah,
Explain what
yeah,
happened and what your own findings
Yeah,
were.
so in 2019 I was doing a CrossFit workout because, I kind of stupid at times.
That's a good student.
And I herniated 2 discs in my back, and I had to have emergency surgery because I was literally paralyzed.
Wow.
So I had a surgery on a Monday morning. I took my last opiate on Monday night, and I called all the smart people I knew, and we came up with a plan. I started on CBD, and I also had some THC that was made for me. And I use CBD with some THC for pain control post-operative day 2 from surgery. And I could be happy to discuss my dosing and all that, which was a much higher dosing. But I was able to recover from back surgery. I was back in the gym in 7 days.
That's incredible.
From being paralyzed.
That's really incredible.
So.
And then without the side effects and the addictive possibility of addiction from opiates.
Opiates are a mess.
Right. It's probably.
You need them when you need them, but
right.
they're a mess.
Yeah, it's from what I understand, it's an incredible tool if used properly that could quickly be less effective and harmful.
So I was taking upwards of 150 milligrams a day of full spectrum CBD.
Right.
And around 5 to 10 milligrams a day of THC.
Awesome. And listen, for those out there that don't like that high feeling and can have full access to the THC, when you combine the high levels of THC with CBD and some other cannabinoids actually take away from your high that you get from THC. So a lot of times, and you'll find in a lot of states where full access is legal, you have what's called a 1-to-1, where you literally have 1 part THC to 1 part CBD. And those kind of give you a balancing of effects anyway, where you're not overly fogged out and high, if you will, and you're getting the entourage effect of pain relief and the benefits of high THC levels, kind of with some training wheels on it, I like to say, where it makes it not as intense, because even for the most avid cannabis user, overdosing, and I use that like taking too much. It doesn't mean you're harmed or die from it, but overdosing on THC can be a very ill effect for even the most avid user. It's very uncomfortable. You feel like you're dying. Sometimes you have to kind of talk yourself back down. But CBD, and from what I've heard from other people now, peppercorn. You can chew on a peppercorn, and there's some other terpene in that kind of reverses the high effect.
That would be caryophyllene.
Caryophyllene. There you go. So, like peppercorns you grind up for your salad or steak or whatever, eat those, and the release of that can kind of snap you out of the intense over the top high you get sometimes from edibles.
Let me touch on that something real quick, and then we'll go on to whatever Mike wants to do next. I fortunately, and I would say I'm truly fortunate that I do get to work with some of the makers and help as we started to look at this. And so I will tell you, and I've used it, a very nice ratio for most people with THC to CBD, if you can access it, is at least a 10-to-1 ratio.
Okay.
So that would be 2.5 milligrams of THC to 25 milligrams of CBD, and that's a wonderful starting point for many people. If you have chronic pain, we would obviously have to use a little more. You have chronic inflammation or Crohn's disease, that sort of gets changed. But that 10-to-1 ratio we find is a very nice ratio. We do find people that do better on the 5-to-1. 1-to-1 tends to be a little potent for most people.
Sure.
I do not see much problems until really THC gets over 5 milligrams. And I'm talking about an oral tincture.
Yeah.
And we start to see euphoria at about 5 milligrams, and then once you get above 10 milligrams, almost definite euphoria.
Oh, yeah. And again, sometimes it can be way too much. But, yeah, I mean, and even for someone, myself and my consumption, I still like to combine the CBD and the THC because they got different effects, and you're going to feel differently on both of them. So, and again, everybody out there watching, if you guys got any questions, just let us know. We'll definitely cover those. We got about 15 minutes or so. We're gonna be doing this a lot more often now. Dr. Farris is. I need to get back involved with him and lose the excuses and lose this weight. And I need, to get back on that. Other than that, I want him back in at least quarterly so we can do this Q&A. And as we learn more about viruses and cannabis and anything in life, he'll come in and share it on us. So anyway, so with all that being said, the cannabis in this state is in a weird space still where we're trying to get full access and things. Where's the guidance as long as from your employer? Where's their stance still for nurses and doctors and their acceptance of these?
That's very interesting. I will tell you, at least in the hospital I work at, and I've had discussion with one of the managers, and we discussed the science behind it.
Sure.
And if you are under my care and I prescribe, for lack of a better term, cannabinoids to you, and you do test positive, I would write you the letter saying this is medicinal.
Awesome.
So that's where we have to start to consider this as, this is medicinal therapy.
Sure.
I can't say that for all employers.
And I get that question a lot from, back when I was in the store, but from people ultimately that know me and know about the CBD store. That's one of the most common questions too is, what can I do about the drug test or whatever? And I often tell people, be honest with your doctor, right? A lot of people lie to their doctor from what I found out. Like, it's kind of embarrassing to tell the truth, but if you don't tell the doctor the truth, they can't help you. And I tell people often too, you'd be surprised how much more effective going to your HR department or your boss on the front side and saying, hey, I'm considering this as a treatment. My doctor thinks this is a good treatment for me. Would this be something that I could get an exception for? And we have customers that come in our store that are active law enforcement, active military.
I take care of state troopers. I mean, and they use THC free,
right,
but they use product.
Sure. And be very sure of what you're taking, because if you don't know, THC free, it has to be certified. We have everything constantly tested, but make sure you know your source, because sometimes there can be THC present even though the bottle says there isn't. Our products that are THC free constantly test to be so. So, but know that. But also, again, if you tell your physician, if you tell your employer, if you're up front, usually they will write you a letter or something saying a certain amount of THC can be present in your system. Does that, does that open up any kind of malpractice issues or anything? Are you covered from that, or is there any kind of national stance?
That's all. Nobody knows the answer to
right,
that.
Okay.
Again, I'm trying to help people.
Sure.
I mean, at the end of the day, if I do the right thing, it's all good.
Sure.
Let me just kind of touch on something, because it kind of brought it up. When you are, if you are considering being a consumer of this wonderful therapy, and that's what I will call it, you need to be able to walk into a store and whatever brand they say, can I see a certificate of quality?
Sure.
Okay? If they cannot produce that, then I would look elsewhere. I don't care what the salesperson tells you.
Sure.
Because now you can validate, and we've gone over this.
Sure.
Right? This is why I will talk to him.
Right.
Because he can validate and show me this is a certificate of quality. It has a certain cultivar. This has been screened for toxins and heavy metals, and we know what's in the product. Where,
right,
God, the people that make it in the bathtub, I don't know.
Right, yeah, and we talk about that often, because it's know your source, because these plants they pick up toxins and from the soil, and curing, they can pick up molds and microbials and all kind of things. So you don't want that kind of thing in your body.
This is a very interesting growing industry.
Right.
And when you
widely unregulated.
It is, but you'll hear the term cultivar. And get to know the term cultivar, because based on every year the climate changes, the soil changes a little bit. No two cultivars will ever be exactly the same.
Sure.
They will always strive, the makers, to make it as consistent,
uniform, yeah.
But realize no two cultivars will ever be exactly equivalent.
And it's so true, because literally you could take clones from the same mother plant plant them in the same environment, grow them with the same nutrients, and end up with different colors, different terpene profiles, different variants in the cannabinoids.
How much sunlight, how much rain,
and,
you know?
Yeah, and how much is absorbed. Listen, so we talked about the coronavirus, cannabis, and everything, and let's talk about more into the pharmaceutical realm. If someone's already being treated for something by pharmaceuticals and they're thinking about introducing this into the regimen to help them, what would you recommend for them? And is there any medications that if you're on, you say to avoid CBD treatment or cannabis treatment?
You know, that's a tough question. What I tell people is I find that CBD can be additive. And what I really want to focus on is using it to help people and get them off of these SSRIs and some of these antidepressants as an alternative, to get them off the extreme amount of pain medicine they're on, because it's a wonderful pain medicine, to get them, to help them with inflammation so they're not taking large doses of ibuprofen and Tylenol. So again, look at CBD as additional therapy to try to lower the dose of pharmaceutical therapy in many cases.
So kind of like a weaning off process.
In fact, one of the big futures of CBD is in the field of addiction.
Yeah.
Very, very big stuff right now in addiction.
And so also, on the same aspect, there's the doctors as a whole, I guess there's a doctor's society or a governing body for you guys? I don't Yeah, okay.
Well, you got a state board and then you have a...
So through them, is there also looking to other natural things like psilocybin for mushrooms and things like that? Is that in the pipeline
great stuff,
as well?
And that's another frontier that's wildly fascinating, because microdot LSD dosing is just doing wonderful things with people who are addicted to alcohol, depression that just has no, realm, PTSD. So again, this is a new frontier that is being researched as we speak right now.
That's amazing. So I guess it's two things I get. The other two questions I get more often is probably the biggest question I get with the biggest demographic is parents trying to help their teenage kids with anxiety. It seems like anxiety is already a huge part of adolescence and coming up in school, but now with this whole new isolation, bullying through the cyber world, it's horrendous. They're facing things that you and I just quite frankly didn't. We all have our own struggles coming up, but that's probably the biggest question I get is this safe for my child, my teenager, my younger than teenager, my preteen? Is this safe? And how much should I give them? And also, can they be taken from me because this is in their system? That's the biggest question.
All right, let me do one at a time.
Sure, yep.
My experience, the youngest person I've ever used it on is 14.
Okay.
They did wonderfully well. Again, it's safe based on guidance and dosing.
So again, low and slow. And...
Start low, see how they do.
Sure.
Don't put them on a big dose, okay? Can they be taken from you? Again, that is a ramification that's beyond the scope of this, because, if they're going out and doing stupid things but what I would tell the parents, you administer the medicine, they don't get their hands on it.
Right.
Now, we know that
it's probably good practice.
We could walk out into his store and both of us take in, 2,000 milligrams of CBD, and the worst thing that would happen is we'd go to sleep.
Right.
So it's not poisonous,
sure,
per se, but we don't want to run that risk.
Absolutely. So, beyond the children and everything, people they usually ask, is this right for me? Is it for everyone? I guess, and then they ask me, do you have a CBD or a CBD compound that's for this specific issue or this specific issue? Where overall, this is pretty much like not a fix-all, but ultimately it helps with overall health, correct? Or is there any specific cannabinoids? And I know CBN or CBG sometimes can be better.
And again, the true answer to that is now we're starting to see these companies that will put together an anti-inflammatory piece of it, where the cultivar does certain things. Then we add in turmeric and black pepper, and then that's more anti-inflammatory. Then we'll start to add in these other terpenes in higher doses, starting to now modulate or direct this for more anxiety or mental health, more for pain, more for inflammation. Where are we going? That's where I think we're going to see a very bright future. There was another question before that, though.
Yeah, I just got so many. I ramble them together, but ultimately it was the.
So yes, we are, as scientists,
Right.
and I consider myself a scientist, we are now beginning to explore these different avenues and trying to target specific CBD strains, types of CBD themselves, and terpene profiles, so that one is more advantageous for mental health, one is more advantageous for pain, one is more advantageous for neuroinflammation. I mean, I can kind of go on and on, but that you start to understand from a scientific standpoint, I now can start targeting therapy.
Sure.
Because CBD is a modulator and it works on the whole piece of it, you know, when you take it, it affects many different aspects of you.
Sure. So I guess the next question I get most often is the dreaded C word for pets and people. My pet now has cancer. My grandmother, my loved one, now has cancer. How does this affect that? Does it help? And there's also been a great amount of studies, well, not studies, a great amount of, I would say, experiments and things that have shown that THC in large amounts reduces some cancer cells.
True.
So if someone has cancer, what do you recommend there? And how does
Again,
it?
and back, I think with the original question, you asked me, is CBD right for you?
Right.
The way I want to answer that is, do you have a condition that you're not getting relief from? So ask yourself that question, and then do your homework, and then ask for help.
Sure.
These people know their product.
We do.
Start slow, give it a month, okay?
Sure.
You cannot give CBD 2 days and say it doesn't work, because you have to, if you have decreased
vitamin,
what is
if you
called
will.
EC or endocannabinoid tone, we have to build that tone up. That's why we talk about when people get antidepressants, we don't see effects for 30 days. So we have to give this plant a month.
Sure.
So don't take it for 2 days and suddenly say, well, you know, this is not for me, it didn't work.
Right.
Because you didn't give it a fair shot, okay?
Sure.
Back to the cancer question.
Right.
It's very interesting because CBD can arrest the growth of some cancer cells, okay?
Okay.
Now, understand what that means. That doesn't mean I'm stopping your cancer.
Sure.
But anything I can do, and this is where I find CBD is a real fascinating drug, it may not be able to stop whatever the disease process is and reverse it, but it can keep it from progressing.
Which is big.
Which
Especially
is
when you're talking about spread of
very
cancer.
big.
Right. So that's, you know, for those out there too, do your research too with Rick Simpson and Rick Simpson oil. It's a natural extraction method of cannabis, probably its most intact form that nature intended. Basically, it's an alcohol extraction where you do an alcohol tincture and then cook off the alcohol, and what you're left with is a gooey substance of cannabinoids and terpene profiles that have shown pretty effective. Mr. Simpson has in treating some cancers. So overall, don't wait until that diagnosis of cancer or something's wrong. If there's absolutely nothing wrong with you, it's still a good idea, I tell people, to do a small regimen, a small dosage, because ultimately this is still an overall regulation. And if you're anything like me, one day you wake up and you're 40 years old and things start to hurt, and you start noticing body changes and things when you turn 40. And if I knew now what I didn't know then, I would take much better care of my body up to this point. But now we're trying to catch up and play behind the scene. But look, if you can do a small regimen every day, it's just going to help with overall health, correct?
That's correct.
I've heard it called the Goldilocks effect, where you're not too hot, you're not too cold, just right, or homeostasis. It helps your body achieve that nice, even pattern of spikes and dips and overall body health, correct?
Again, great medicinal therapy, great therapeutic effects. I can't tell you this is for everybody.
Sure. So we're going to be rounding up the hour, and I just want to give you a minute to look, if anybody out there is interested in speaking to Dr. Farris on a personal level or going to his practice to get into a better health routine or whatever, it's highly recommended. It came highly recommended to me. If I weren't so stubborn and didn't make so many excuses, I would have been on a much better path this year, which I plan on doing in 2021. But ultimately, how can we find you, Dr. Farris? If someone wants to come check you out, sit in your chair, get on a better health plan, a health path, how can they do so?
So my office number is 704-786-4970.
Do that again, one more time.
704-786-4970.
Awesome.
They can contact us directly. I'm jerryfarrismd@gmail.com, and my web address is gefarrismd.com.
That's awesome. Also known as Dr. Danger. I love
Yes.
that. I love the
Great story
nickname
behind
there.
that one, but yes.
There is. So yeah, Basel just posted the phone number up there for you. And look, guys, we're going to try to do this again more often. We all have so many questions, and again, it's hard to find credible sources. And Dr. Farris has been an amazing, credible source for us through all of this. And you know, I thank you so much for being on the front lines and your colleagues as well, because this is absolutely terrifying. It is for me. It is as a business owner. It's been that delicate balance between being successful business and not putting staff in harm's way. And I feel like we're constantly dancing between that balance. But ultimately, people are handling it well. Our staff is simply amazing. I can't say enough about you guys. For those watching or will watch later, you guys are the real magic behind this. But the front lines is a special, challenging place right now for everyone, but especially doctors and nurses, and that see this absolutely ravaged mess every day. But thank you for taking time out your busy schedule to be here. If you feel like out there watching that there's something we didn't cover, maybe you come up with a question later, shoot it to us. We can get an answer from Dr. Farris for you at any time. And overall, man, thanks so much.
Yeah,
Truly.
I mean, it's always an honor and pleasure to be with good people. Folks, I just will leave you with this, and I say this to a lot of people, including myself. Figure out what you can do and quit focusing on what you can't do.
That's it. And that's it, man. Excuses kill more dreams than failure ever did. That's a quote I read the other day, and it's true.
Be strong, be faithful, you can do it.
Don't be fearful of failure. Failure is literally part of success. So I, myself, had taken this year to mentally get in a better place. And coming into 2021, it's all about physical for me. I want to get into a better physical state to be here longer and be here for my children and my wife. And hopefully with the guidance of Dr. Farris and the accountability of you guys, we're going to make that happen.
Him being accountable to me, that'll be hilarious.
Yeah, I'm trying to get better. But listen, thank you, everyone. We're almost through 2020. Holy shit, what a year. Thank you, everyone, for being part of this. Thanks for your support. And you guys are the absolute reason why we're here and successful in what we do. So thank you. We're almost through 2020. Not that 2021 is going to be the ultimate fix, but at least it's a fresh start. And we have the vaccine with the wind at our back now to get to a better place. So thank you again, Dr. Farris. Thank you all for joining. We'll join you guys again soon. Love you all. Happy New Year. Happy holidays. Thank you.